Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Ray Dorsey. He's a neurologist, and today's Kevin MD article is Expanding the Parkinson's Universe of Care for Patients, Caregivers, Clinicians, and Communities. Ray, welcome to the show.
Thank you very much for having me, Kevin. Delighted to be with you.
All right, so tell us a little bit about your story briefly, and then jump right into the article that you co-wrote.
Sure. So I'm a neurologist. I care for people with Parkinson's disease. And like most physicians, we were taught in medical school, most diseases associated with aging are either due to aging, genetics, and maybe some combination of bad luck. And my colleague and I wrote a book called The Parkinson's Plan that just came out in August, in which we argue that Parkinson's disease, one of the world's fastest growing brain diseases, is in large part a man-made disease. That chemicals in our food, water, and air, including certain pesticides, dry cleaning chemicals, if you can believe it, and outdoor air pollution, are fueling this rise of Parkinson's disease. And the conclusion then is that Parkinson's disease is fundamentally a preventable disease. It's not a natural consequence of aging, it's an unnatural consequence of aging and a preventable disease.
All right, so tell us about some of the underappreciated risk factors of Parkinson's disease that you certainly talk about in your book.
Yes, so one of them, the one that's probably most well established, are certain pesticides. Pesticides are nerve toxins. That's how they kill insects. And one pesticide is a weed killer called paraquat, widely sprayed on corn, soybean, cotton fields, vineyards, even throughout the United States. Research shown in 2011 showed that farmers who work with the chemical have 150% increased risk of developing the disease. In the laboratory, it reproduces the features of Parkinson's disease, including even tremor in laboratory animals, if you can believe it. Over 50 countries, including China, have banned it, but the United States has not. In fact, according to the U.S. Geological Survey, over the last 5 years, for which data are available, use of paraquat in the United States has doubled.
All right, so let's go on and talk about the article that you shared on Kevin MD, Expanding the Parkinson's Universe of Care for Patients, Caregivers, Clinicians, and Communities. Now, for those who didn't get a chance to read your article, tell us what it's about.
So in addition to the book, in addition to highlighting the preventable nature of Parkinson's disease, it talks about redesigning the way care is delivered for people with Parkinson's disease. And it starts with the premise of putting the patient at the center of the universe, and then extends the analogy that what's closest to the patient is the caregiver, and that's the planet Mercury. And Mercury can get really, really hot. And it can be very hard to be a caregiver. As you know, people who are caregiving for individuals with chronic diseases have their own adverse health consequences themselves. And then it goes out to the Venus being the family and friends of the person, then the clinicians. And then it talks about things that are difficult to asteroid belt in terms of negotiating insurance and prior authorizations. And then it talks about Pluto, which is always there, and stigma associated with the disease. So we put together, in addition, identifying the underlying causes of the disease, we put forth a new care model for Parkinson's disease in the book.
All right, so tell us about the implications of this new care model. What do you hope to achieve with that model?
Well, the challenge is that for people with Parkinson's disease, only 9% of people with Parkinson's disease in the United States see a Parkinson's specialist, and only about 40% more see a neurologist. Said another way, 40% of Americans who have health insurance with Parkinson's disease don't even see a neurologist for their care. And those that don't have worse health outcomes. They're more likely to fall, they're more likely to fracture their hip, they're more likely to be in a skilled nursing facility, and more likely to die and die prematurely. So we need better care models, not just for Parkinson's, but for other chronic diseases. And then my real passion, though, is what can we do to prevent people from getting these chronic diseases? When you and I were in medical school, type 2
Mhm.
diabetes was rare. Ulcerative colitis and Crohn's disease were rare. Parkinson's disease was mentioned, but you didn't walk the streets of New York and see people with Parkinson's disease everywhere you went. Many of these diseases are tied to factors that are in our environment and our society. If we identify what the causes of diseases have causes. If we identify what the causes of diseases are, we can take action to prevent them, to slow them, treat them, and eventually cure them. We did that for peptic ulcer disease, which lo and behold was due to a bacteria, right? We
Mhm.
were taught it
Yeah.
was due to stress, and it was due to a bacteria. If we find out what the environmental causes of Parkinson's disease are, certain pesticides, dry cleaning chemicals like this chemical trichloroethylene, air pollution, we can take actions to prevent people from ever getting this disease and bring about its fall. Parkinson's disease wasn't described as a major clinical entity until 1817 by Dr. James Parkinson, Writing in London, he described 6 people with the disease, and he says, I'm describing a disease that's not been classified in the medical literature. 2 centuries after he describes Parkinson's disease, the Global Burden of Disease study estimates that 6 million people have the condition.
Hmm.
So you go from a case series of 6 individuals to 6 million in the span of 200 years. It can't be genetics. Aging alone is insufficient to explain its rise. Chemicals are fueling the rise of this chronic disease. If we take action to prevent exposure to these chemicals, we prevent people from ever getting one of the world's fastest growing brain diseases.
Okay, so let's talk about prevention strategies. So, both from a policy standpoint and an individual standpoint, what are some things that we can do to move the needle when it comes to Parkinson's prevention?
So in the book, we outlined the Parkinson's prevention pyramid. What are actions we can take as actions we can take in our community, and actions we can take as a society to prevent getting Parkinson's disease. And then on page 237 of our book is the Parkinson's 25. 25 actions individuals can take in their everyday life to reduce the likelihood of getting Parkinson's disease. I'll read the first one. Wash your produce, even your organic ones. Pesticides have contaminated our food supply. Remnants of pesticides are found in 20% of common foods. Organic produce, dairy products, and meat can reduce exposure, but can still have unsafe residues of pesticides. So wash your produce at least with water and consider simple vegetable washes, vinegar, or salt solutions too. So we give you 25 very simple things: dry cleaning cautiously, using a water filter, or using an air purifier. Avoid poisoning yourself by using pesticides at home to reduce your risk of exposure to these toxins. Then we say, what can you do in your community? We can ask our kids' schools to stop spraying pesticides, many of which are nerve toxins, on our kids' schools and playgrounds. Schools routinely, as I've learned writing this book, schools routinely spray pesticides, many of which are nerve toxins, on kids' playgrounds and schools. And we ask why 1 in 31 8-year-olds have autism. I think we need to be a lot smarter about what we're doing to our children and exposure into their everyday life. And then what can we do as a society? And we can ban pesticides. If China has found it in their public health interest to ban a pesticide linked to Parkinson's disease, the United States can certainly do the same. We're long overdue to ban the pesticide called paraquat. And people can call the EPA administrator, Lee Zeldin, and ask him to simply ban paraquat like England and China have done.
Now, what are some of the obstacles that prevents us from doing so? Is the paraquat industry, are they fighting back, the pesticide industry?
Yeah, I mean, there's some concern, there's a MAHA movement in the United States, and there's some concern about regulatory capture. I think if you saw the first MAHA report, it detailed the risk that pesticides present to children's health and chronic conditions, but its strategy was tepid. They said we need better spraying strategies so less spraying occurs outside of its target. There was a study done by Dr. Beata Ritz and Kimberly Paul that showed that simply living or working near where paraquat is sprayed is associated with doubling of your risk of Parkinson's disease. It's like secondhand smoke. You don't have to actually be the person smoking the
Hmm.
cigarette to be at risk of developing lung cancer. Simply living near where paraquat is sprayed, or another study by Dr. Brittany Krzyzanowski, simply living within a mile of a golf course is associated with 126% increased risk of developing Parkinson's disease. So Susan Sontag has this great quote, says we need to be serious, we need to be passionate, and we need to wake up. If we're serious, passionate, and wake up to the dangers and the likely causes of many of these chronic conditions, we can create a world where 140 million Americans don't have a chronic condition, where 80% of healthcare expenditures are not on chronic diseases, where Parkinson's disease is not the world's leading growing neurological disorder, where 1 in 3 85-year-olds do not develop Alzheimer's disease. This is all largely in our control. If we change the course, we change our behaviors, we change the course of these diseases, and we all live longer, healthier lives.
One of the things you mentioned earlier is that a minority of Parkinson's patients with health insurance see a neurologist. What are some of the barriers preventing them from doing so?
I mean, there just quite frankly aren't enough neurologists. There are only about 40 Parkinson's specialists are trained a year. 250 Americans will be diagnosed with Parkinson's disease today. We're never going to get out of this by training more and more physicians. The parable I like is the parable of the river. And, this small community saw these bodies coming downstream, and these bodies were damaged and injured. And the community took the bodies out of the river and cared for them. And more bodies kept coming down the river. And they got better and better at caring for them and created more and more sophisticated approaches to caring for these individuals. They were doing such a good job that the local priests even blessed them for their efforts. But no one bothered to go upstream and to ask, why are these bodies coming down in the river?
Hmm.
We're asking, why are these bodies coming down the river? Why is Parkinson's one of the world's fastest growing brain diseases? Why are 1 in 31 children getting autism? Why 1 in 33 85-year-olds getting Alzheimer's disease? If we ask these questions, we find out the root causes of the disease and we prevent people from ever getting these diseases in the first place.
All right. So tell us your ideal situation. If you were in charge of all policy in your ideal world, what would you like to see happen?
So at the federal government, we can just ban paraquat. That should be done. There was another chemicals that are linked to is trichloroethylene, perchloroethylene, the most widely used dry cleaning chemical in the United States, and its cousin are associated with a 500% increased risk of Parkinson's disease. One's known to cause cancer, one likely causes cancer. The EPA has banned them with a phase out for 10 years. We can accelerate that. If people live near a contaminated site or live near a golf course or live near where paraquat is being sprayed, they have the right to know that they're being exposed to these chemicals. Individuals have the right to know if they live near a Superfund site. About 20 million Americans live within a mile of a Superfund site, the most toxic sites in the United States. People should be notified annually that they live near these sites so that they can take actions to protect themselves and their family members. And then at community level, we can stop spraying pesticides on kids' playgrounds and schools. We should, kids don't mind weeds. We can live in California, create the Healthy Schools Act, which banned the most use of the most toxic pesticides on kids' schools and require schools to notify parents in writing in advance of the use of pesticides. That same thing can be applied across the country. So there are a wide range of things that we can do to take actions to prevent people from not just getting Parkinson's disease, but likely other neurological disorders as well.
And as far as you know, any major initiatives in our country for any one of the things that you just mentioned?
Well, so the trichloroethylene, perchloroethylene were banned in late 2024. The current administration put a freeze on that ban. My understanding is that freeze is going to end and that this ban will be put into place, so it can be done. Europe has banned paraquat. Europe got rid of trichloroethylene. Europe's air quality has improved, and it appears that the number of new cases of Parkinson's in Europe adjusted for age might be peaking, if not beginning already to fall. We can do the same thing. In our book, we outlined that our goal by 2035, 10 years from now, if you have me back as a guest, that the rise of Parkinson's disease is 0% adjusted for age in the United States. We have a 0% rise in the incidence of Parkinson's disease adjusted for age. So in 2036, we start talking about the fall of Parkinson's disease. Diseases come and go. Infectious diseases did not really occur in humans until about 10,000 years ago when we had the Agrarian Revolution and cities were formed, which allowed the spread of infectious diseases. And we've said goodbye to smallpox. We've largely said goodbye to polio. We've largely said goodbye to yellow fever. We've said goodbye to a wide range of infectious diseases. We've said goodbye to bleeding ulcers. When we were in training, or before we were in training, bleeding ulcers was a top 10 leading cause of death in the United States. You and I saw lots of people coming in with bleeding ulcers in our training. Now it's like almost a non-event because we found out what the cause of the disease is, and we're saying goodbye to bleeding ulcers. We can say goodbye to Parkinson's disease, to a large portion of it. We can say goodbye to a large portion of ALS. These diseases have very little to do with genetics, a lot to do with the environment. If we change our environment and get rid of pesticides, certain pesticides on our kids' schools, playgrounds, sports fields, water, and our air.
So how about in primary care setting? What are some of the questions that I can ask in my exam room to make patients more aware of the preventable causes of Parkinson's? And what can I do to better coordinate care for those with Parkinson's?
So I think the first thing that we have to do as clinicians is when we find someone with a diagnosis is to ask why. So in our book, we outline a plan. P is to prevent the disease. L is to learn why. A is to amplify the voices of those affected. And then navigate the frontier of treatments. But once you learn why someone has a disease, you can take better action to address it and to prevent it. If someone comes in with lung cancer, you're going to figure out why they have lung cancer. Is it because they have radon in their house? If they have radon in their house, they need a radon remediation system to prevent them from getting ongoing exposure to radon. If they're smoking, you're going to counsel them to stop smoking. But if a farmer comes in with Parkinson's disease, are we telling them to limit their exposure to pesticides? If someone works with a degreasing chemical and comes in with Parkinson's disease or cancer, like non-Hodgkin's lymphoma linked to trichloroethylene, are we asking them, do they work with these chemicals and telling them to stop getting exposed? And in the book, we give you 25 recommendations that individuals can take to reduce their exposure to these chemicals, to either slow the rate of progression of the disease possibly, or to prevent them from getting it. But we should figure out why people get diseases so we can prevent them, slow them, treat them, and eventually cure them.
We're talking to Ray Dorsey. He's a neurologist, co-wrote the Kevin MD article, Expanding the Parkinson's Universe of Care for Patients, Caregivers, Clinicians, and Communities. Ray, let's end with some take-home messages that you want to leave with the Kevin MD audience.
One of the world's fastest growing diseases is Parkinson's disease. It is not an inevitable consequence of aging. Chemicals in our foods, like certain pesticides, in our water, like dry cleaning chemicals, in our air, like outdoor air pollution, are fueling the rise of the disease. If we take actions as individuals to limit our exposure to these chemicals, water filters, air purifiers, testing your water for pesticides, in our communities, asking our schools to stop spraying toxic pesticides on our kids' playgrounds and sports fields, and as a society ban the pesticide called paraquat, we create a world where Parkinson's disease is increasingly rare instead of increasingly common, and we can be part of the generation that brings about the end of Parkinson's disease.
Ray, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
My pleasure.